Now, like a plague, the Ebola virus disease spread across some countries within the West African sub-region, unsettling governments within the worries and the manner in which the deadly virus spreads and kills. Now, since it was first noticed on Nigerian soil, the nation rose to fight. And today, the World Health Organization has confirmed Nigeria Ebola-free. In this report, we take a quick look at how the fight began since the 20th of July, that's July the 20th, 2014, when the index case arrived in Nigeria.
It was a sad day for the nation. The day the Liberian-American Mr. Patrick Sawyer touched down on Nigerian soil. No one knew he was carrying with him the dreadful and deadly Ebola virus. From the Murtala Muhammed International Airport in Lagos, where Mr. Sawyer showed he was critically ill. The first point of call was at the First Consultant Hospital in Lagos. Mr. Sawyer was to attend an ECOWAS meeting, but on getting to Lagos aboard a flight from Monrovia via the Togolese capital Lomé, Mr. Jato Abdulkadri, a protocol assistant with ECOWAS who helped Mr. Sawyer, is one of the casualties of the EVD. Reports reveal that Mr. Sawyer escaped quarantine in his country, Liberia. He was said to have been under surveillance after he had contact with someone who died from Ebola. But how he got on the flight headed for Nigeria leaves much to be desired. At the First Consultant Hospital in Lagos. There, experts who were unaware of the case of the patient got in contact. Unfortunately, it is a contact no one ever envisaged, a medical case different from the usual, so dangerous as being in the line of fire. Dr. Stella Adadevo, the lead consultant and endocrinologist at the First Consultant Hospital, was one of those who came to Mr. Sawyer's rescue. Despite pressure from senior diplomats at the Liberian embassy for Mr. Sawyer's release, Dr. Adadevo put her feet down to prevent what could have become a national catastrophe, a case which is now celebrated as a supreme prize for the nation. A nurse, Justina Ejelanu, also of the First Consultant Hospital, who also treated Mr. Sawyer, lost the battle to Ebola.
We at First Consultant Medical Center took a risk. We sacrificed our lives because we knew that we wanted to ensure the safety of Lagosians, Nigerians, and humanity, because we're a global village. From a small village, it can spread to the world, and we knew the implication, but we said we would risk our lives. We would not let the index case leave the hospital.
So that when they are...
The Lagos government mobilized immediately when it got wind of the situation. The government called journalists and sounded a bell to the world and Lagos residents to beware of the disease in town.
Tuesday, July 22nd, the Lagos State Ministry of Health received information concerning a suspected case of Ebola virus disease from a private health facility.
From Lagos, the case was reported also in the south-south region of the country in Port Harcourt. And then the federal government relentlessly worked to see that Ebola is defeated.
We cannot afford to lower our guards.
Today, the good news is that Nigeria is Ebola-free. A news difficult for some skeptics to believe, but a success story that evidently shows that Nigeria can overcome any challenge it's united on. Shehu Okimbale, Channels Television News.
Okay, now to throw more light on the successful containment and, of course, the sustenance of Nigeria's Ebola-free status, I'm now being joined on the News at 10 by the Lagos State Commissioner for Health, Dr. Jide Idris. Thank you so much for joining us on the News at 10 tonight.
My pleasure.
Well, congratulations to the nation tonight for this spectacular feat. Officially now, we're in the clear. But you see the W.H.O. saying we shouldn't let down our guard. Where do we take it from here?
Well, that's very correct. Well, we should all celebrate this feat. And like everybody said again, we should not rest on our oars. That we're still not out of the woods yet. For as long as we have those cases in Liberia, the situation in Sierra Leone and Guinea, we are still vulnerable. And as a state government, and again in line with what is being planned at the federal level, there are certain things we've decided we're going to do. Some of these things we've started doing. One, we need to address the issue of the ports of entry, because the only case that came to the country was introduced here. We still have chances that this might be introduced if you are not careful. And that's why we have to face the borders. And like the federal minister said, the ports of entry, the airports, seaports, and land borders, we need to step up activities.
Yeah, but we keep hearing that we need to. Yeah. But what exactly is going to be done to make sure it doesn't happen again? Obviously, we all know that the need is there. Yeah. But, even the presidency has talked about, directing health officials to, continue to actively screen. Are we ready for that? What exactly
the screen has not stopped. We're going to step up that, because we're increasing, every day we increase the number of people we screened, all flights, all vehicles moving into the land borders, and those areas where we feel that still porous, we're going to be blocked. We're training, we continue to retrain all the various health workers that are involved in this, because it's a continuous thing.
And then looking at, it's not
apart from that, at our own center here, we still need to continue to train all the health workers, both public and private, because there were challenges we observed when this disease was in here. A lot of fears, what people were doing wrongly. We need to correct that. So we need to continue to train the health workers, both public and private health workers. We need to continue sensitization, which is key. And more importantly, there is a program, the enhanced surveillance program. Basically, we're going to continue to survey, cover surveillance activities, that's actively collecting data from all our health facilities, data on health, illnesses, or anything that will lead to Ebola. This is active surveillance. We're going to step up with the community awareness program too, because remember when we started, we went into the community, we're getting community leaders, community informants, they know precisely what to do. Any substantial cases, they just link us to the Ebola.
Well, you see, when we look at the case in America, there was that issue of how did the particular health worker take the suit off? Did she do it properly? Didn't she do it properly? Yeah. And some said, oh, perhaps she was exposed before or after. So what are we actually? I don't know. So perhaps we were lucky.
No, in our case, there was we had a strict protocol. Everybody was working in the treatment room, how to go through that training. It was very specific. How to put on the gear, how to remove the gear. Even when we are within the premises, we get the specific protocols, and this training is continuous. They train all the doctors, all the nurses, all the hygienists who are working there. And we decided to step up the training. Translate this one out to the various hospitals, just in case, because they need to come. We don't pray that should happen, and let them start to learn, start to enjoy the protocol of dealing with this kind of thing.
All right, like everybody else has said, we need to look at it from the root, from countries like Liberia, Sierra Leone. What is Nigeria doing to ensure that such countries are assisted or have their own success story? Because as you said, we're all at risk. As long as there is one case, everybody is at risk. So have we done enough? Are we going, what exactly is going to be done? There's so much talk about helping, but we don't see how. I
know that we're proud to this. I think that the federal government has sent in some relief materials to those countries. But specifically, at least from the point of view of Lagos State, and we're working hand in hand with the federal government on this one, there's a plan to send in a team there, a team of some of the people who've trained, who are assisted with various aspects of this containment, to go to Liberia to assist. We've compiled a team. Lagos State team is ready, but again, this is going to be coordinated by the federal ministry and the W.H.O. We've linked up with them, and they're just working out the logistics in doing that.
Okay, Lagos State Commissioner for Health, Dr. Jide Idris, thank you so much for sharing your thoughts with us tonight on the news at 10.
You're welcome.
Now, we've looked at efforts at the state level, but what's happening at federal level? The acting Minister of Health, Dr. Haliru Al-Hassan, has assured Nigerians that the Ebola-free status certification issued by Nigeria by the World Health Organization will be maintained by the federal government. Dr. Al-Hassan, who disclosed this in Abuja shortly after taking over the affairs of the Ministry of Health from the immediate part minister, Professor Onyebuchi, promised that the government will increase surveillance at all entry ports into the country. He also announced plans by the government to further equip isolation centers, in addition to establishing new ones across the country.
It's a day of celebration for Nigeria being declared Ebola-free. However, this is also a time that we'll have to start working assiduously to ensure that there will be no repeat. We must continue to keep alert, actively to survey all the port of entry to ensure that people are properly screened. We should be on our guard. Our health workers should be on the alert. There's no time to rest. We must continue to keep Ebola away. Through the leadership of Mr. President Goodluck Ebele Jonathan, it has been always leadership collaboration with the states. We have worked well with Lagos State while this incident started. This is followed by continuous collaboration both in Enugu and in Rivers State. Therefore, the answer is continuity. Yes, we must collaborate, including with our partners, W.H.O, UNICEF, and other partners. We must continue to work together to ensure that, yes, more facilities, more laboratories will be created across the nation to ensure that prompt diagnosis is being given anytime there is need for that.
Providing more laboratories and trained personnel are the next areas the Nigerian government must focus on as the country wins the fight against Ebola virus disease. And this is coming from a virologist at the Lagos University Teaching Hospital, Professor Sunday Omilabu, who warns against non-vigilance. Our correspondent Loretta Chiogo reports.
WHO officially declares that Nigeria is now free of Ebola virus transmission.
Government and the people would have to work together to ensure that the EVD is stamped out. Campaigns on what must be avoided and done take over the media. Official resumption of schools after a long vacation is extended to prevent further spread. Funds are released by the government for an immediate setup of an equipped virology laboratory affiliated with the Lagos University Teaching Hospital, LUTH. However, in 2 months, the death toll rose to about 8, most of them health workers. Many others were quarantined and treated, while others walked away free from the EVD after a 6-week incubation period of checks on them.
It's a remarkable moment for Nigeria and, of course, Nigerians. This is as the World Health Organization declares the country Ebola-free. Nigeria has been able to tackle Ebola in the shortest of time. And since August the 31st, there's been no new case of Ebola. The World Health Organization certification for any country to be Ebola-free comes 42 days after the last patient has been declared Ebola-free as well and discharged from the hospital.
National governments and international agencies, such as the United States Center for Disease Control and Prevention, have also commended Nigeria for the successful containment of the Ebola disease, a feat many say was possible through a united resolve by all, particularly the health workers, while some others say it's just a miracle. Nigerians react to the good news from the World Health Organization, but caution remains the watchword.
We shouldn't relax, we should be vigilant, because we don't know where it can generate at any time, and we need to be conscious. And the drugs should be available, and the way we interact with people should be limited, and we should wash our hands regularly and make sure we clean our environment, and we should be healthy all the time.
That's good news because we've been very scared and worried. So that's good news. It's a plus. For now, we'll still be careful. We don't really have to believe everything they say. Let's watch, let's see. At least we've not heard of Ebola recently. So that means they are correct. They have tried.
And people need to be informed that we need to keep our body clean, especially our hands. Before we eat, let's wash our hands. Once we engage in any physical exercise, let's wash our hands, and just for preventive measure to be sure. But as far as I'm concerned, I feel Ebola is no longer around, so everybody should be at peace.
As Ebola still ravages countries like Guinea, Sierra Leone, and the worst hit Liberia, Nigeria has to be wary of another importation of the disease.
Laboratories are very, very germane to prompt detection and management of a disease outbreak. In a country of over 170 million, we need to have more of such laboratory facilities. So we need to develop more facilities in this country to be able to give a prompt diagnosis with adequate training. So, and aside that, we need to put in place active surveillance.
Checks are still on in the schools, banks, and other public places, especially the border areas and the airport, to ensure the EVD is not again imported into the country. Loretta Chiogo, Channels Television News.
When the News at 10 returns, Finance Minister Professor Ngozi Okonjo-Iweala says there's a need to boost the excess crude accounts. That will be on Business News. Do join us again.